So today I'm going to be performing a neurological assessment. I'm going to be using the Glasgow Coma Scale. So whenever I first walk in, I can see that her eyes are spontaneous to my voice, and so she'll get 4 points for that category. Now I'm going to check her verbal response. So can you tell me your name and date of birth?
Alex Duncan, 5/17/2000.
And do you know what day it is?
Saturday.
And do you know what town we're in?
Brookfield.
Okay, and so that's expected. So she'll get 5 points for that category, and then I'm going to check her motor response. Can you reach up and grab my hands? Okay. So then she'll get 6 points for that because she can obey the commands. So altogether she'll have a score of 15, which is perfect. Okay, so now I'm going to observe her posture and position. She's sitting upright. She appears to not be in any pain or discomfort. Her general appearance, she has good hygiene. She seems clean. It's appropriate for the situation. And then do you have any pain today?
Nope.
And then since she doesn't have any pain, I don't have to assess that any further. I'm going to check her vital signs. So her temperature was 98.6. Her heart rate was 80. Her blood pressure was 126/80. Respiration's 18. And then SpO2 was 98% on room air. So all of those were within normal limits. Now I'm going to check her visual deficits. So that's cranial nerve 2. So can you cover one eye and read that paper?
TULV.
And then can you switch it into the other side?
TULV.
And then put both of them down and do it without any.
TULV.
Okay. Now I'm going to check hearing deficits. So that's cranial nerve 8. So can you cover one ear and tell me the word that I whisper in your ear?
Banana.
Okay. And then do it to the other side.
Couch.
Okay. And that was perfect. Okay. And then I'm going to check a recent and a remote memory. So can you tell me who the president is?
Donald Trump.
Okay. And then what did you have for lunch today?
Chicken and rice.
Okay. And then just by talking to her, I can tell that she doesn't have any speech pattern difficulties. And then that's cranial nerve 10. Okay, and then now I'm going to move on to the eye and pupil assessment. So that's going to assess cranial nerves 2, 3, 4, and 6. Okay, I'm going to shine a light in your eyes. Can you just look up for me? Okay, so her light's dilated to the light. And then can you look at the clock? And then now look at my pen. And then back at the clock. Okay, so that's accommodation. And, okay. And then can you hold your head still and just look at the pen and just move your eyes. Okay, so her eyes were pearlet, and then I assessed all 6 cardinal fields of gaze, and that was okay. Now moving on to the motor function. Can you smile for me? Can you frown? And then puff out your cheeks. Okay, so that was cranial nerve 7, and that was okay. Now I'm going to have you perform the Romberg test. So can you stand up for me, please? And then just put your arms to your side and close your eyes. And so I'm just going to assess for any shuffling, unbalancedness, and I'm going to hold my hand behind her back just for safety, just in case. Okay, so that looks good. You seem pretty steady. And then I'm going to assess your gait. So can you walk across the room for me? Okay, and then can you come back? Okay, that seems pretty symmetrical. Okay, and then you can go ahead and sit down. And I'm going to assess our muscle tone, strength, and coordination. So I'm going to do grips. So can you squeeze? Okay, that was equal and strong. Okay, then can you push against my hands? And then push down against my hands? Okay. And then can you lift up your legs? And then push against me? And then push against me again? Okay, strong and equal. Then can you put your arms straight out? And then push against me? And push against me again? Okay, strong and equal. So that was cranial nerve 5. And now I'm going to, I'm just going to touch you, and just tell me whenever you feel me touch you, okay?
Touch. 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 Touch.
Okay.
Touch. 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 Touch.
Okay, and now tell me if it's a sharp object or a soft object.
Soft. Sharp. 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 Soft.
those were all good. So again, that was cranial nerve 5. Okay, now I'm going to assess your gag reflex and your ability to swallow. Can you just open your mouth for me? Okay, that's good. And can you take a drink of water? Okay, so she was able to swallow and her gag reflex was okay. So that was cranial nerve 9 and 10 that I just assessed. And I'm going to test her deep tendon reflexes. Okay. Okay. And then I'm going to assess for Babinski's, so can you lift up your foot? Okay. So her toes curled in, which is correct for an adult. If they curled out, then that wouldn't be okay. And that's all.